Good day, and welcome to the Understanding Outcomes and Applying Lessons Learned, Monitoring and Evaluation in Implementation conference call. Today's call is being recorded. At this time, I'd like to turn the conference over to Chris King. Please go ahead.
With more than 25 years of public and private sector child welfare experience, Will Hornsby's work has focused on implementation science principles, systematic problem-solving approaches, and assisting state and local agencies in monitoring their child welfare programs. With more than 30 years of experience in working with child welfare systems, Joan Nelson Phillips is a CQI and practice improvement expert consultant. With 19 years of experience using implementation science, learning science, and continuous quality improvement frameworks to improve the effectiveness of social services, Matt Davis, PhD, is a research associate professor at the University of Utah and an evaluation consultant to the Child Welfare Capacity Building Collaborative.
Will Hornsby is the Vice President for Child Welfare Practice at the Center for the Support of Families, and Joan Nelson Phillips is a Senior Associate at the Center for the Support of Families. Matt Davis is the Evaluation Coach and Consultant for the Capacity Building Center for States.
I will now turn it over to our facilitator today, Simon Pipkin.
Thanks, Chris. All right, good afternoon and good morning to some of you. Welcome again to today's event on monitoring and evaluation in implementation. Here you see the agenda for today's event. As with all of our events, if you've attended prior, we will provide a quick overview of our change and implementation process. Then we'll move into today's content by setting the stage, discussing monitoring and evaluation, applying findings, then building evidence in child welfare through evaluation, and also provide you an opportunity to ask questions to our expert panelists. Our learning objective for today's events are to learn about the essential tasks for monitoring and evaluation, discover strategies to prepare for and perform monitoring and evaluation work, acquire knowledge about using data to inform decisions, and hear about common challenges and ways to overcome, both from the content of the event and also from our awesome experts. Before we jump into the topic, we're going to introduce or reintroduce for many of you and highlight our change and implementation process. Here is an image that I'm sure is very familiar to you if you've attended previous events and or have worked with the center. This visual provides an overview of our change and implementation series as a whole. In addition to the topic for today, I'll announce that we do have other briefs that are available across this series, and they can be found on the Center for States website. Those briefs include a general overview, problem exploration, theory of change, teaming, readiness, intervention selection, adaptation and design, and intervention testing, piloting, and staging. Today we're talking about the monitoring, evaluating, and applying findings brief and hearing from our subject matter experts on how to apply that information that's found in the brief to actual practice. As you'll note, later today or later in this event, there will be a resource pod where you'll be able to see and access this brief, and it will also be available on our website in the next couple of weeks. As shown in the graphic, while this topic is shown at the end of this cycle, considerations on how to monitor progress of implementation and intervention effectiveness, as well as considering the evaluation needs of the intervention in your agency's context, are critical throughout the change and implementation process. And thinking about how to measure and evaluate progress should be discussed early and often, and we will discuss that here shortly. As with all the steps in the process, having a diverse team that is representative of all stakeholder groups and understanding agency readiness are integral to successful efforts. Teaming for evaluation is particularly critical as agencies need a partner, either within your agency or outside, with evaluation and data analysis expertise.
The intervention selection for change and implementation diagram shows a ring of circles. The outer green circle is labeled readiness. The next inner circle is blue and is divided into 6 topics. Clockwise from the right, the 6 topics are problem exploration, theory of change, intervention selection and design/adaptation, implementation planning and capacity building, intervention testing, piloting, and staging, and monitoring, evaluating, and applying findings. The next inner circle is orange and is labeled teaming. The innermost white circle is labeled effective implementation.
Just a little bit more about the brief itself. This brief has 11 steps, or as we call them, essential functions. It's divided into 4 parts, including setting the stage, data collection and analysis, using data to make decisions and adjustments, and sustainability planning. It is important to remember that not all agencies or teams will complete all of the tasks in the brief, depending on your circumstances. And while the steps are presented in this linear way, in practice we know that these steps will overlap and teams may loop back and forth between functions as they monitor progress, evaluate, and apply findings. And we will review some of these sections today for you, but we really want to focus on hearing from our experts that have practice experience in doing this work, which will include common challenges, strategies, successes, and applying lessons learned.
Part 1. Setting the stage for monitoring and evaluation. Steps include 1. Consider the circumstances and needs of the agency. 2. Develop a logic model. 3. Identify questions. 4. Identify measures, data sources, and potential data collection methods. And 5. Develop an evaluation plan. Part 2. Data collection and analysis. Steps include 6. Collect and analyze data. Featured topics. 7. Examine fidelity. And 8. Analyze cost. Part 3. Using data to make decisions and adjustments. Steps include 9. Share findings and recommendations. And 10. Make decisions to further spread, adjust, or discontinue the intervention. And Part 4. Sustainability planning. Steps include 11. Refine and implement a sustainability plan.
Okay, so we're going to take just a couple of minutes and we're going to have a poll, 3 areas of a poll, and we want to hear about your experiences with evaluation and how to use data to make decisions. So the first is just select what is your experience with planning for and implementing a rigorous evaluation. It goes from no experience at all to a lot of experience. I'll give you guys a few seconds to click away at that. Looks like so far the majority has some experience. We do have a sprinkling of a lot of experience. That's great, a good amount of experience. And we do have folks that have no experience at all, and that's fine. Okay, and so as you're doing that, we'll move to the other 2 questions, and here's you just type in a short response. So what challenges or successes have you encountered in evaluating an intervention or a program? Design comes after the selection or the creation of the intervention. That's a challenge. It's a good one. It's messy or incomplete data. Yes, data quality or access to data could definitely be a challenge. Limited resources. Yeah, we'll talk about that as far as who to get, how do you get them. No desired outcomes while planning. Limited capacity. Yes, all this is going to be about capacity as well. Great. It's an afterthought at our agency. Yeah, I've run into that. Legal issues, of course. Okay, well, let's go to the last question here. It says, what challenges or successes have you encountered in evaluating an intervention or program? Not measuring the same outcomes or definitions, they vary. Seeing competing priorities. So a lot of the information that's being entered here, it does ring true for me. I hope for our panelists this rings true for them. They'll be talking about some of these experiences and also some of our content. Some of our content, or a lot of our content, will address these at a higher level, but that's why we have panelists to help bring it home for us. So that's great. I'll just give it a few more seconds for you guys to type in a few more answers and move forward. And I do apologize. I just noticed that's the same question twice, but maybe you had 2 different answers. Okay. Great. Thank you, everybody, for responding to those.
Polling results. For the question, what is your experience with planning for and implementing a rigorous evaluation of a new intervention or program? 17.1% of participants responded, no experience at all. 62.8% responded, some experience. 12.8% responded, a good amount of experience. And 7.14% responded, a lot of experience. For the question, what challenges or successes have you encountered in evaluating an intervention or program? Other answers include determining what is working and what is wasting time, lack of protocols, not collecting the right data across the entire project, and having sufficient samples and counterfactuals.
Okay. I think we can move back to the content. Thank you. Again, thanks for those responses. I believe what I saw based on your varying degrees of experience and also the successes, challenges, and barriers that you had listed, that there's going to be information that hopefully will touch on a lot of that, and each of you will find something valuable to take from not only the content but also hearing from our experts. So let's get started and let's set the stage for monitoring and evaluation. So the concepts of monitoring and evaluation are in some ways similar and can overlap, but they are also they have their own distinct differences. Both, of course, use data to inform decision-making and guide improvements, but also the data collected from monitoring can be used in evaluation and vice versa. So let's get a little technical and just provide some definitions to ground us in this. So monitoring is generally an ongoing process for tracking and reporting on program activities and reviewing progress against plans, whereas evaluation is defined as a systematic method for using data to answer questions at specified points in time over the course of implementation to make assessments or judgments. Many child welfare agencies conduct monitoring. In my work, I find that monitoring is more familiar, we're more competent in that area, but they conduct monitoring on a routine basis to answer basic questions such as what activities were conducted, and what services were provided, and have activities been conducted as planned? Are they on schedule? Are they within budget? Whereas evaluation is necessary to answer the more complex questions about why or why not, how, and with what results and outcomes, and typically involve additional data sources and study designs, which we'll touch on shortly. There are numerous ways to categorize evaluations, and terms are sometimes used in different ways and maybe even defined differently depending on the context. This series, when we talk about the brief and the content today, focuses on two key purposes of evaluation, which are formative and summative, that are important when attempting to achieve the intended outcomes of an intervention through a change implementation process. So formative evaluations, or some have referred to, and the literature refers to as process evaluations, help teams assess functioning, track progress, and guide improvements to the intervention and implementation. Summative evaluations, are also known as outcome evaluation, helps teams to determine the effectiveness of the intervention in achieving desired outcomes, and really should only be done once a program or practice is no longer being tweaked with or modified. It's in place and it's ready to be evaluated. But in addition to these two purposes we've highlighted, fidelity assessment is also an important one to mention. It is often considered part of formative evaluation, whereas formative evaluation will answer what helps or serves as barriers to implementing a model as designed. But a fidelity assessment can also inform summative evaluation, particularly in cases when outcomes are not being achieved or they stand alone, which can result in the identification of what's needed, such as supports, training, coaching, and new guidelines. But let me see if I could drill this down just a bit and provide a couple examples of when do you conduct these types of evaluations. First, when teams have introduced a new program and staff are adjusting to the new practices and routines, the agency may want to conduct a fidelity assessment to ensure that the program delivery is consistent with the selected model. Another example would be when teams have adapted an existing program to fit the agency, its context, its target population, and the community. The agency may want to conduct a formative evaluation to see if key aspects are functioning as expected and make improvements, particularly during the early stages of implementation. One final example of this would be when teams have tested and adjusted a well-defined intervention that has shown early signs of success in piloting, they may want to conduct a summative evaluation to assess its effectiveness. As we know, though, these are all connected and should be connected. So ongoing monitoring is connected to both CQI and evaluation efforts. While monitoring is the simple task of collecting the data and reviewing trends over time, the same data can often be used in different ways depending on what question you're trying to answer. So teams should make efforts to connect the data collected through ongoing monitoring to existing CQI strategies, for example, data dialogues or case reviews are a couple that pop up. With that, let's hear a brief example of this, of how this interconnectedness works. So a jurisdiction conducts a CQI case review, and it identifies that there are challenges with the current assessment process. So the team comes together, engages in problem exploration, they develop a very sound theory of change, and all of this leads to the introduction of a new approach to assessment, which we, of course, would include a new tool, training, and coaching of caseworkers. Monitoring collects that data on how often trainings occur and how many caseworkers are trained on the new tool and how that compares to what was planned. Evaluation, on the other hand, then takes a closer look at whether that new tool is being used as intended by using fidelity assessments, identifies what's working well and what's not, and actually why not, which gets into our formative evaluation. And then after some changes are made initially, a summative evaluation may then explore whether the new approach is effective in helping to improve targeted services that meet family needs. But following that evaluation, teams may decide to go ahead and expand the use of the tool and training more broadly across the state. And then once the tool, training, and coaching are routine practice, it's fully operationalized, it's in your system, then you go back to ongoing monitoring in CQI. So that kind of highlights some connectedness there. Okay, so we just talked a little bit about what's done, the purposes, what's done, when it's done. So now it's important to talk about, well, who does it? Who will do it? So implementation teams looking to embark on evaluation activities might need support from experienced evaluators with both data collection and analysis skills. So where do we turn for evaluation help? That I think is a great question, even though I asked it. But let's review some sources and talk about where we might find those. Again, I'm going to just shout out a few, but this isn't an exhaustive list because you guys know your own communities and agency and where you might find that help. But first and foremost, you start within. Are there some internal child welfare agency data, CQI, or evaluation staff? Maybe you have internal evaluation staff that can provide assistance. You can turn to foundations, some nonprofit foundations in your community, or local universities seem to be the one that many go to. There are some national technical assistance and capacity building providers that can provide evaluation assistance, and always reach out to your peers across the state and county lines and see what other child welfare agencies might have that could offer assistance. Now, while teams may need to bring in experienced evaluators to design plans, collect the data, conduct analysis, evaluation, as we know, is not the job of evaluators alone. Various stakeholders may, for example, help develop, prioritize questions to be answered. They can provide input into data collection tools and help with realistic data collection processes. They also participate by responding to surveys, focus groups, and they can help interpret, communicate, and apply findings across the community and state. It is important to continue with this team approach embraced throughout the change and implementation process or practice. Engaging and gaining buy-in from stakeholders may take time and resources to develop the relationships and capacity, but we know, as we've seen in our work, it does foster valuable input from varied perspectives.
Other sources for evaluation team members are partner systems, target audience members, and decision makers.
So earlier I noted that monitoring and evaluation should be attended to early and often and not left as a final step in the process. So teams are encouraged to prepare for monitoring and evaluation in several areas of implementation. I know some of the challenges and areas you guys listed in your poll were around it's an afterthought or it comes late. But there is some good science that talks about where are some natural points to begin those conversations. And so within implementation, there's the areas that this includes would be when you're developing your theory of change. As you're selecting, adapting, and designing an intervention, you want to think about evaluation. And while you're developing your implementation plan or you're piloting and testing the intervention are all great points around beginning to have that discussion about evaluation and monitoring. And each of those areas, there's some questions or focus points that will help guide your team as you consider monitoring evaluation at each of those steps. So for example, during development of a theory of change, you might ask what indicators will help track progress at each step in the pathway of change that eventually could lead to very sound research questions or things to evaluate. When you're selecting your intervention, consider if that intervention and its core components are well defined enough to evaluate. Ask, can it be differentiated from practice as usual? During implementation planning, think about how you will be able to tell whether the strategies or practices have been integrated within the system. And lastly, when you're in piloting, testing, and staging, just be mindful of site preparation activities that may affect readiness and capacity and how you might explore which factors supported implementation. It is important that monitoring and evaluation activities do become this part of the change process, a central part of your change process, so that desired information and data can be documented, early analysis can inform mid-course corrections, and that through any pilot or testing periods. Often teams, all of you guys are implementing something that's been adapted, some intervention adapted, and it's critical to consider the questions of interest and potential measurements of these adaptations as part of your monitoring and evaluation efforts. All right. Oh, that was a lot of information, and I don't know how long that took, but that felt like I just went through a lecture. So now is the time we're going to introduce, our panelists are going to come on board and take some of that information and put it in some applications. So I'll kick this off, and I will start with Matt. Matt, can you tell us about some examples of your work with jurisdictions in using monitoring, fidelity assessment, formative evaluation, summative evaluation, all the things we just talked about, and particularly how they all have worked together?
Yeah, sure. You know, at the most basic level, I look at monitoring and evaluation as a structured way to learn from experience. And it's often said that child welfare, given the daily crises that occur, can become crisis-driven. I think we've all probably experienced how difficult it is to learn and improve in a crisis-driven system. So I think ongoing monitoring and evaluation is crucial to getting out of a reactionary crisis-driven approach to child welfare, and also to consistently provide effective services. I want to echo what you said, Simon. Oftentimes the various types of monitoring and evaluation are taken individually. So to provide an illustrative example, I worked with a jurisdiction that was making a system-wide change. With the jurisdiction's help, we, the evaluators, were able to conduct a formative, summative evaluation. It provided reliable information on what was working, what was not. We were able to show, actually, that the intervention was effective. However, as many of you will know on the call, unanticipated system changes occurred at the same time, which resulted in many of the participants who were eligible not receiving the intervention. So using this information, the jurisdiction was able to focus their efforts on correcting the unanticipated system changes. And crucially, the intervention was not misperceived as being ineffective because we knew that these were the larger system issues. So as an evaluator, this was great success. We were feeling really good. And those working on the project had done it. We'd done our job by providing useful information that could improve practice. However, the jurisdiction lacked an ongoing monitoring process for things like this intervention. There was no continuous quality improvement system. So once funding for the changes ended, there was no way to know if the system changes that they had put in place were going to continue to be effective. They needed the initial evaluations so that they could see whether or not these changes would be effective, but in addition, they also needed ongoing monitoring, such as a CQI system or something similar, in order to see if the effects were sustained over time. So I look at it as the monitoring and the evaluation are used together, but perhaps at different times to make sure that the changes that we're implementing actually lead to improvement over the long term. One more example, a jurisdiction I worked with had an ongoing, a really sophisticated ongoing CQI system. Many system level indicators. They had reports, internet-based dashboards that could provide detailed look at factors such as removal rates, They could do things such as identify geographic regions that had high removal rates. So this was really impressive and helpful. However, they lacked the ability to look deeper at why they might be having a higher removal rate in a particular area. And this is where you touched on it earlier, another type of evaluation activity such as a fidelity assessment, and I'm broadly defining it here, can come in. Without a structured method for gathering data on whether workers or service providers are following practice profiles or the evidence-based treatment manuals, the jurisdiction was left in the dark when it came time to figure out the why behind the information that they were gathering at a broad level with their CQI system. So I think the types of monitoring and evaluation we're talking about can work together as a whole to create a system that's able to consistently improve over time and provide effective services. I think that ongoing monitoring can identify areas that need attention. Fidelity assessments can be used in many ways, one of which is to find out the why behind a problematic situation. And then, of course, formative and summative evaluations can be used to identify whether plan changes, such as new practice approaches, safety assessments, or services result in the intended effects. I wanted to switch over to Joan, and Joan, I'm wondering what, in your experience, would you say are the most important things jurisdictions need to consider when they put together an effective team for monitoring and evaluation? And in addition, what are some of the strategies you've seen utilized when jurisdictions don't have ready access to the types of expertise needed to develop or implement an evaluation plan?
Sure, and thanks, Matt. I think everything that you just talked about is really useful information for the folks on the line, so I appreciate that. There are several important issues, I think, when it comes to teaming for jurisdictions to take into consideration. However, in my experience, it also depends on where they're at in the change and implementation process in terms of when they begin planning for how to best monitor and evaluate their intervention. And this obviously pivots off of what you and Simon have just been talking about. For example, if there's already a well-functioning implementation team in place that includes a diverse mix of internal agency, programmatic, and staff level representation, as well as your key external stakeholders, really important would include your system and community partners that are involved in the intervention and your service recipients such as your youth, parents, family members. And the focus at this stage in the process is likely going to be on whether any additional expertise is going to be needed on the team. So it's, of course, incredibly helpful, ideally, to have individuals on the team from the get-go who are experienced in data collection and analysis, such as your CQI or data leads within your agency. But when it gets to the point of beginning the process of really developing that actual evaluation plan for an intervention, in my experience, it's not so much a luxury, but really more of a necessity that an experienced evaluator is brought on to support the team. And this, again, this builds on what you've all talked about, Simon really covered, that you want to make sure it's not just the role of an evaluator, but an evaluator brings so much to the table when you're trying to build a plan like this. So a skilled evaluator is going to be able to assist the team in making decisions as to what type of evaluation, like Matt and Simon have just been talking about, what's best suited for the agency's objectives for their specific intervention. They're also going to be able to help the team in the design plans for the evaluation, figuring out the best methods, based on the agency's capacity for collecting relevant data, conducting analyses, and finally coming up with effective and user-friendly ways to share those evaluation findings with the agency stakeholders. What I've seen sometimes is jurisdictions not place the right level of importance on having this level of evaluation expertise on the team from the very beginning for their intervention. Sometimes I think we see that maybe, or we think that our formal evaluation functions are things that can maybe be carried out through less formal CQI and monitoring activities, but I've seen folks maybe regret sometimes down the road not having brought in that type of expertise on sooner. It's also going to be worthwhile, in my experience, to ensure that there's somebody on the team, hopefully more than one, that has strong programmatic knowledge or expertise around that selected intervention. And this is really important when it comes to helping the team developing a logic model and then ultimately designing a fidelity assessment for the intervention. In terms of those types of situations where a jurisdiction doesn't appear to have ready access to the types of evaluation expertise that they're going to need for their intervention, I think it can be helpful for the team to first take a quick step back, and I think Simon kind of touched on this, to really assess your internal agency evaluation capacity. Brainstorm whether or not you might actually have existing staff within your agency, because our agencies are big and complex, or maybe agency partners who can contribute to an evaluation planning effort. The more formal evaluation expertise, however, I think can often be found, and we've touched on this, through university research partnerships. And I've seen jurisdictions successfully really modify existing contracts that they have with universities to incorporate additional intervention-specific evaluation activities into the contract that they already have, as well as sometimes securing new contracts with established research institutions or sometimes other foundations that are willing to fund broader change and implementation efforts. So with that, I'm going to throw a question over to Will and ask what specific stakeholders have you had experience with in terms of meaningfully engaging around monitoring and evaluating an intervention, and have there been any identified gaps in terms of stakeholders who should have been engaged around monitoring and evaluating an intervention, but they actually were not brought in?
Great, thanks, Joan. Yeah, engaging and communicating with stakeholders around monitoring and evaluation activities ideally is integrated into and therefore more of a continuation or extension of the jurisdiction's broader change and implementation effort. And I've had experiences where, you know, some real thought was put in of trying to make sure to engage the type of people that have been identified thus far to make sure that you've got the, you know, different perspectives and the different skills and knowledge to be able to address these within the implementation team. And this means that internal and external agency stakeholders need to be well represented on the implementation team, and that the jurisdiction, it's really helpful if they're implementing an effective communication strategy for the intervention where these key stakeholders are being kept informed as the implementation process continues to unfold. I've seen jurisdictions share key components of their evaluation plan, such as the logic model and actual evaluation design for the intervention, with agency staff and key stakeholders through already established agency committees and advisory groups, sometimes with additional time built in to allow for stakeholders to ask questions and provide feedback. Evaluation findings, as they become available, can also be disseminated and shared in this way. It's also important to make every effort to put any evaluation-related information out in a way that is as user-friendly as possible, given its oftentimes, you know, technical nature. I think the main thing that I've learned in doing this type of change and implementation work is that while it does take a little more effort at the front end to integrate this type of thinking and planning in terms of really engaging our staff and stakeholders in an evaluation process, it's worth it in the end and frankly problematic when they're not engaged. It's just so important to continually get and use the input from those individuals who are delivering or implementing the intervention, and of course those who are going to be most affected by the intervention, the children and families being served. It brings transparency to the change and implementation process. It's empowering to the staff and our stakeholders, and it helps build agency capacity for conducting future monitoring and evaluation activities. So with that, we're going to hand things back over to Simon.
Thank you, Will. Thank you, Matt and Joan. That was Great information. It really brought to life the content that we just briefly went over, but it's great to have your experiences. And as a reminder to the folks on this call and in this event that, we're going to have a short Q&A session at the end of the presentation, so you'll have a chance to type in your questions and have the presenters and experts respond. So just take note of any questions that come up for you guys, either through the content and also as you listen to Matt, Joan, and Will. So, all right, we're going to move right back into the content. And now we're going to moving from monitoring to evaluation. Okay, so let's spend a few minutes with something I know most, if not all, are familiar with, and that's logic models. And we know that a project logic model is a visual representation, as you see an example. Well, it's not an example, but it's just the structure of one on the screen. It's a visual representation of an intervention that shows inputs, activities, outputs, and outcomes in a structured format. Some logic models that I've seen also present assumptions or factors that may influence outcomes and the indicators. It does serve as a roadmap for your evaluation effort. For teams that are implementing an established evidence-supported intervention, check with the program developers. They may have included a logic model with their program materials. So in those cases, you'll want to review that and adapt that logic model if it's needed to be adapted for your own context, for local context, I should say. Other times, however, teams will create their own logic models, building out from their theory of change and the research that was conducted in selecting the appropriate intervention. So as you see on the screen here, let's go over these key components that your teams, as they're building out logic models, want to both identify and include in that logic model. And so the first we see, of course, are inputs. And these are the various materials and resources needed to deliver the intervention. These may include trained staff, maybe there's curriculum, guidelines, even equipment, as well as strategic partnerships. So as we go over these, we'll iron them down with some example, and this is related to a home visiting program. So with a home visiting program, some of those inputs might include the actual model, the established model, funding, technical assistance from the purveyor or some other technical assistance provider, skilled home visitors. So identifying the inputs allows the teams to assess whether there are adequate resources and structures to carry out the next piece, which are the activities, or the second piece to the logic model. And activities represent the things the team plans to do with the inputs to address the identified problem. And so certain activities, this can include activities that are related to the intervention's core components and service delivery, or activities to prepare for and support the intervention's implementation. So back to the home visiting program, an example might be that some activities might include the outreach to at-risk parents, the home visits, activities around parent and child screenings, and referrals to community services. That's at the practice level, that's at the intervention level, but also there are some system level activities which might include developing collaborative agreements or MOUs or holding collaborative meetings. The third piece after activities as part of a logic model are your outputs. And so typically outputs really are those tangible things. They're things that can be counted or may also represent products created, such as practice guides, guidelines, policies. You should really think about outputs at both, as we said earlier, the system and practice level. So again, back to the home visiting program or visitation program. The examples would include the number of families served, number and duration of home visits, number of referrals, and types of services. Or if you move that up to the system level, going back to our previous example, it would be the actual number of collaborative agreements that have been created and signed by all parties, or actual number of meetings. And that leads us to our fourth component of a logic model, which are our short-term and intermediate outcomes that will actually result from the planned activities and outputs. These may include changes at the system, agency, or community level, such as changes in policy, shifts in the organizational culture, engagement of community service providers, or changes related to the target population, including changes in awareness, knowledge, attitudes, skills, behaviors, overall functioning. And we know it's pretty common sense, but outcomes should be presented in a logical progression showing what may need to happen first before something else happens over time, such as first some changes in knowledge and skills before we get to behavior changes. So, for example, we would see an outcome around increased parental knowledge of child development, or at least awareness of services around child development, before leading to the actual positive parent-child interaction. So that's the sequence we're looking for. At the system level, they might include increased communication with partner organizations, leading to improved coordination in case planning. And the last component of the logic model, of course, is your ultimate long-term outcomes, which represent the desired conditions for the system, your agency, and or the target population as a result of the intervention's activities. For example, long-term improvements in child and family well-being and enhanced safety. That's what we're trying to get to. In child welfare, we know that long-term outcomes are often expressed in terms of the safety, permanency, and well-being of children, youth, and families. And sometimes these changes may take several years to occur. Once team members have created a logic model that they believe fairly represents their intervention, they should share it with stakeholders, just like Will was talking about sharing with stakeholders and keeping them included. You know, stakeholders, it can include, it's not limited to, but there's additional partners, potential service recipients, evaluators, technical assistance providers, agency leadership, funders, families, youth, all the folks that would need to be in part of this. And this may lead to needing to continue to clarify and make adjustments based on feedback, but you need that feedback. Now with your teams, and also including that you're getting input from agency leaders, evaluators, other staff, system partners, service recipients, the list can go on. You can use logic models to guide ideas for what questions to explore as you're trying to build out towards that evaluation plan. Now at this point, as you're developing this and thinking about it, you may just end up with some general questions of interest, but those will guide the direction of the evaluation plan. And evaluators can use these questions, general or not, to develop more specific and targeted research questions. So here in this visual, there are some potential questions of interest that might be generated from the home visitation logic model example. You see some inputs. Were the services adequate? Was the model delivered as intended? To what extent did the program reach the families that were eligible? And so on, and you see the outcomes.
Questions to explore for activities include, was the model delivered as intended? And what factors were barriers? A question to explore for output includes, to what extent did the program reach eligible families? A question to explore for short and intermediate outcomes includes, are families receiving services more likely to see improved interactions? And a question to explore for long-term outcomes includes, is family and child well-being improving?
So next, teams should identify the data they need to answer selected questions and understand their intervention's functioning, progress toward goals, and effects on the desired changes. And one way to do that is what's here is the makeup of a measurement framework. And so a measurement framework is a useful stepping stone in moving from the logic model to the actual plan for monitoring and evaluation. As you can see on your screen, a measurement framework includes 4 main elements that teams should consider to answer the questions they developed. These elements include, the first that you see there are measures, which we know is the information and data that can be used to assess whether progress was made toward the desired change. These may include process fidelity or outcome measures. The second area or element is around data collection sources, which, as you know, is where we find relevant data. I mean, it's administrative databases, program records, case files, staff, servant participants, surveys, and things of that nature. A third element is, okay, how are you going to collect that data? What's the data collection methods? These are the strategies for actually collecting the data from those sources that were identified, which may include just examining the administrative data or reviewing program or case records, conducting those surveys, interviews, focus groups with the staff and service participants that were identified as sources, or actually observing staff service delivery and completing certain checklists that get to measuring the core components of the intervention. And lastly, the final element you see is how often will the data be collected? What's the frequency measure that we're putting into that? So this type of measurement framework I think may be useful for thinking about needs for both ongoing monitoring and also specific evaluation efforts. All right, so here's a small sample. So let's look at this example of part of a measurement framework for the home visitation program we've been discussing in the earlier portion. So the framework example outlines, you see from the left to the right, a question of interest, then the output or outcome associated with the question, the measures that the team will need to track to answer the questions, the data sources and methods that will provide the data, and how often the data should be collected. So in this snippet of a measurement framework, we see that the team is interested in determining, one, whether the home visiting program was delivered with fidelity. They plan to determine this by examining home visits as one area. Model fidelity will be measured by the number of visits and how long they lasted. The data will be collected through numerous sources or a variety of sources such as case reviews, observations, and surveys. And the information will be collected, the frequency is monthly and at least at a minimum every 3 months.
The second example examines the question, are families receiving services more likely to see improvements in interactions? The output/outcome is positive parent-child interactions. Measures include use of identified positive parenting and discipline techniques. The method/source includes observations and interviews with home visitors and parents. And the frequency is at program entry and every 3 months.
Measurement frameworks and data collection protocols can support your teams to establish expectations on gathering data to monitor trends over time by identifying the who is responsible, what data will be gathered, when it will be gathered, where from, and how it will be obtained, and can be part of just the overall implementation plan. Monitoring inputs, activities, outputs, and outcomes supports oversight of an implementation effort and helps teams assess whether activities are conducted and outputs, which can include events and products, are generated as planned and according to schedule and budget, and also supporting ongoing quality assurance and CQI processes. Both monitoring and evaluation protocols and the plans may evolve and solidify over time as teams complete implementation plans and think critically about what it is they want to know. They will both inform and be informed by your intervention testing, pilot, and staging activities, as well as any adjustments made to the interventions over time. Okay, it seemed like that section even had more information. So now let's take a pause from hearing from me and bring back our expert panelists, and I will start and kick off the first question to Joan. And so Joan, what in your experience are the biggest benefits to a team taking the time to develop a logic model for an intervention, and maybe some potential perils in skipping over this as well, and also, what are the biggest challenges teams encounter when developing a logic model? Can you share any strategies that you have seen in addressing such challenges?
Yeah, thanks so much, Simon. So I mean, I guess first of all, what comes to mind is the simple act of developing a logic model can be such an engaging, roll up your sleeves type of activity for a team to take part in, because just in my experience, it's really truly team building at its best. When it's done well, the entire team is really working together to think through in step-by-step fashion in order to create what is essentially the evaluation plan framework for their unique intervention. And what you've kind of seen from some of these slides today that we've been going through is simply the clear visual representation of the different facets to the intervention. In other words, the resources, the key activities, the desired results, the outcomes that a logic model offers on its own provides a tremendous benefit in my experience. A logic model can be used effectively by teams to help facilitate and ensure a shared understanding of the intervention, because we know how complex some of this stuff is, the evaluation approach and the expected outcomes with a jurisdiction, staff, and stakeholders. I think the biggest disadvantage or potential peril I see in jurisdictions when they skip over the step is that they miss out, first of all, on this opportunity that I've just been talking about to work through the process of developing their logic model together. The action of brainstorming with one another, having the opportunity to agree or disagree with one another, and then come to consensus in the simplest terms, what they plan to do and what they expect to see as a result of implementing their intervention. Not having a well thought out logic model, I think, makes it harder to communicate the vision for the intervention with agency leadership and key stakeholders. I think the main challenges I've seen with jurisdictions in being open to developing a logic model is sometimes around the time commitment, or at least what they think the time commitment is going to be. For example, not feeling like they have the time for it, or seeing the process is sometimes unnecessary. And I think this is especially true where a team may have already developed what they feel is a solid theory of change for their intervention, and they may see the process of developing the logic model as being repetitive. And I think just you have heard from Simon, just from some of the content we covered today, that they really are not the same. It's more of an extension and building off of the theory of change. So in these types of situations, what I've tried to do is really reinforce the benefits that I've already kind of mentioned here now to developing a good logic model, and also taking the time to provide further clarification as to the differences between a theory of change and a logic model, specifically the benefits of both and what makes them different. I think the other thing is really trying to reach out to leadership, sometimes making sure that they can kind of see the benefits to being able to take the logic model and visually communicate the intervention framework in presentations and meetings that they have with staff and stakeholders. So I'm going to shift gears a little bit here and throw a question over to Will. Will, are there common challenges or barriers that implementation teams face being an effective data collection protocol?
Yeah, thanks, John. Yes, the monitoring, evaluating, and applying findings brief addresses the issue of developing tools and protocols, and contains information from the Permanency Innovations Initiative Training and Technical Assistance Project regarding the development of fidelity tools that I think are relevant to the development of other data collection protocols. To begin with, implementation teams may struggle with identifying meaningful measures that will serve as the foundation for developing appropriate data collection protocols. Once a decision is made about the type of data gathering protocol that should be developed, and Simon was talking about some of the different options, there are challenging issues to address, such as how often should the protocol be completed, who will be responsible for completing the protocol, independent observers, CQI staff, program managers, supervisors. Will all staff or cases be reviewed, or will there be a sample? All these issues have resource implications attached. The sampling, raises representation questions. How will people completing the protocol be trained? How will the organization ensure that it's consistently being applied? How will data from the protocols be collected, aggregated, stored, maintained? How will confidentiality be protected? And how will findings and recommendations be shared? With all of these challenges, the decisions around how to address these, require a balance between, that real desire for the best information available, but then also the practical realities of what's feasible within an organization.
With that, I'll turn it back over to Simon.
All right. Thank you, Matt, Will, and Joan. Also, thank you to you guys out there that have posted questions in the chat we've taken note of those questions, and we'll bring those up during our Q&A session. I just don't want you to think we've neglected those. All right, so we can move ahead with the content. And so now we're going to shift to the evaluating and applying findings. So there are several different ways to design evaluations. I'm sure you're all aware of that. Building from the evaluation questions, evaluators will help teams make decisions about which design is the best fit. And often when assessing outcomes, evaluators will be thinking about comparisons in their studies or in their designs. So those comparisons could be between individuals before and after the intervention, like pre, post-tests or time series. They can also be individuals randomly selected to participate with other similar individuals, which is what is known as experimental design. A final comparison can be individuals receiving and not receiving services that are not randomly selected, but in comparable groups referred to as quasi-experimental. Also, some study designs, such as case studies, can provide richer understanding of how the program unfolds in different circumstances. So there are several factors that evaluators look at to make decisions about the evaluation design, including the questions of interest, evidence base for the intervention, and whether it has been adapted, the desired rigor, available data, resources for evaluation, timeframes, and so on and so on. It can go on for forever on that. So developing plans that are appropriate and feasible is a critical activity, and teams need to implement their plan by collecting the data identified, analyzing it, and then sharing it with stakeholders. In order to ensure sufficient response rates, teams may need to build buy-in and encourage participation in the data collection process. Teams should clearly explain why they are collecting data and how the findings will be used to improve services. You can identify evaluation champions to help with communicating the value of data collection that obviously leads to decision making. Also, teams may encourage participation by offering incentives, one if it's appropriate and allowable in your agencies, but it's one way to ensure some participation. And assuring participation is anonymous and confidential can also help improve participant comfort levels with responding openly, particularly in surveys and interviews. To support data collection and promote data quality, teams should develop protocols, distribute guidance, and conduct training as needed. Internal or your external evaluators, your data analysts, CQI specialists, can lead the data analysis. Teams can identify the trends in counts, patterns, or frequencies, and comparisons. Experienced data analysts can develop some awesome data visualizations and displays that not only support the analysis, provide good interpretation, and they're just easy and maybe fun to look at for those that are reviewing what the findings are. Okay, so let's take a look at fidelity. Earlier we mentioned fidelity assessments. A fidelity assessment is an essential part of an effective change and implementation process, and it can overlap with and inform valuations. Now, fidelity assessments generally measure two types of information. One is the extent to which the intervention's core components are delivered, which in technical terms is known as adherence. Second, fidelity assessments measure the quality with which the core components are delivered, which is another scientific term is referred to as competence. But these fidelity assessments, they can help teams in several ways. One is to ensure that a selected intervention is being implemented as designed. We've mentioned that. Another benefit of this assessment is that it helps identify needs for training, coaching, practice guidelines, or other supports, maybe some booster trainings, other things that needed to get that intervention up and going and within fidelity. And lastly, these assessments, these fidelity assessments, they bring attention to the system barriers that need to be addressed. One example might be that there's current policies that actually don't support what we're trying to put into place, and so that would be a system barrier. So regardless of the type of evaluation the team has been working on, and Will mentioned this earlier, is that you need to take time, or they should take time, to review findings with stakeholders. So with formative evaluation, teams use the evaluation findings to determine next steps and further develop their intervention. Now, I'm going to say something that's going to sound like common sense, but I really strongly think it needs to be stated. Anytime the team discovers, through evaluation or other measures, that the intervention is actually causing harm to children, youth, or families, then you should just stop implementation and move on to something else. More often, though, what we find in the data, it may point to areas for some adjustment in implementation processes or to the intervention to actually improve it. So teams can turn to understand, to get to these adjustments, you can use rapid learning methods such as plan, do, study, act cycles. That helps to identify what's working, what's not working, then make the adjustments and determine next steps. You know, as far as adjustments, what those might look like, these might include improvements to the reach of the program, changes to improve receptivity to the program among children, families served, or even to improve fit with the agency, or adjustments may require adaptations of agency policies or guidance so that new practices align better and they are monitored. When making adjustments, any adjustments to an intervention, you know, the team should continue to be mindful of maintaining the integrity of the intervention model and its core components. When we asked that poll question earlier about challenges and barriers and things you've seen, I've seen cases where they make so many adjustments for every piece of feedback or measure they're looking at that what they end up on the other end is not even close to what they started with. So we want to be careful with that. Teams should also examine the reasons behind any failure to achieve the perceived or intended outcomes before making adjustments. So always start by asking, was it due to poor implementation or the efforts or process, or is it due to fidelity? Teams also use formative evaluation findings to decide if it is time to move on to the summative evaluation. So at this point, you've made all your adjustments, the intervention is in place, the implementation supports are there, and you're ready to start measuring its effectiveness. So as I stated earlier, the same with formative evaluations, the same is true with summative. Review the findings with the stakeholders. Now, the decisions about next steps after summative evaluation might include deciding to either continue implementation or spread the intervention into new areas if it has shown effectiveness and desired outcomes for the target population. In some cases, teams may not yet have evidence of long-term outcomes. Remember earlier I said it might take several years to reach some of those long-term outcomes. But they still may decide to sustain a program based on certain criteria. For example, if we are seeing that the intervention is addressing a significant need, it's making some impact, there's a solid theory of change, and stakeholders, internal and external, support it and they see the positive benefits of it. If findings do not show desired outcomes, it is important to investigate the reasons why this may be the case and decide if there can be adjustments made to the implementation, the process or fidelity or pieces of the intervention, or if the team should actually revise the study design. Now, not all interventions should be sustained. You know, it's okay, and I know I'm speaking to an audience that's working in child welfare agencies or helping child welfare agencies, but you don't always have to keep going. If you need to make a decision to discontinue based on harm, cost, capacity, or other key factors, that's okay. So, when making decisions about whether and how to sustain and or expand an intervention, teams should consider not only the evaluation findings, but also readiness and capacity. So there are several capacity considerations to explore that will help your teams and your agencies determine whether to keep marching on or make a decision to stop. And you see on the slide here on your screen, these are the areas around capacity to think about exploring to understand more about can we sustain this intervention. So in exploring this, you'll want to ask as you go through these, is there ongoing leadership support for the intervention? Is the support felt and understood at all levels of the agency? Are there visible stakeholders that advocate and garner ongoing support? Does the organizational culture actually foster its success? Does the external environment, which can be cross systems or your legislation or legislature and other policies, does it actually promote sustainment? How does workforce morale affect implementation? One important question you should have on the table very early, is there sufficient funding and staff to support continuation or expansion? Have intervention-specific knowledge and skills been institutionalized to carry on practices? Can implementation support, such as training, coaching, fidelity monitoring, data systems, can those be sustained to build capacity for ongoing implementation and improvement? Have key stakeholders been adequately engaged? Are there partnerships with external systems or community organizations that actually contribute to service delivery? Are they intact? When continuing is the decision of all key groups and the team, and there is sufficient capacity, plus the evaluation saying so, to continue, then developing or refining a plan for sustainability is your next step. And speak of the devil, here we move into sustainability. So when developing sustainability plans, you should incorporate proposed strategies to maintain and foster organizational capacity in the areas that you see on the screen. The first, of course, around sustainability is the resources, where includes funding, staffing, materials. The next area you see is infrastructure, including implementation supports that facilitate staff recruitment, retention, training, coaching, of course your data systems, communication avenues. Another area for consideration here is your knowledge and skills. This isn't just focusing only on intervention-specific knowledge and skills that carry out service delivery, but also program management and what agency skills that are needed around evaluation, CQI, those pieces. Next you'll see is the organizational culture and climate, which is including strategies that encourage continued buy-in and motivation for the intervention throughout the intervention. And lastly, we talk about is engagement partnerships, which simply is partnering with system partners, community organizations, families, youth, other stakeholders that we've pretty much talked about throughout this presentation. So teams should think through what, if anything, needs to change in moving the intervention forward, such as what new policies need to be put in place, where will the program be housed, how will staff be organized. Teams may also need to spend some time researching ongoing and additional funding streams to cover anticipated costs, particularly if it's within a grant or a special project that will be ending. And I underscore that you think about those things very early on. So now we're going to turn back to our panelists to drive home some of this information in more applicable terms. So I'll start off by asking the question to Matt. So Matt, monitoring, evaluating, and applying findings covers a lot of area. How does a jurisdiction complete these tasks if they're lacking the technical skills or capacity that seem required? And what, maybe crucial areas do jurisdictions need to do but often don't?
Sure. And Simon, let me know if my audio cut out. I think last time it was cutting out a little bit, but
it sounds great.
Yeah. Okay, great. So yeah, what we're talking about today does cover a lot of area. It's large enough. I really don't believe any one person or even agency has all the skills. So I think to do things right, jurisdictions need to partner. They need to partner probably with other folks, and maybe if they're in a Department of Human Services or universities like we were talking about earlier. When deciding to get outside expertise, I think one of the things that's really important is finding someone who has content expertise in child welfare, because that's it's crucial not just to be an evaluator, but to also know the nuances of child welfare and what kind of what kind of data exists and what kind of measurement approaches are good, and how to I mean, oftentimes we have a really difficult time recruiting participants, and so knowing those kinds of things is very important. Regarding crucial areas that jurisdictions need to do but often don't, I wanted to combine this with, I think it was David And David S. said that he was also wondering what the most crucial area was. And in my mind, it's making sure that you have correct blueprints. But what I mean by that is the blueprints in an evaluation to me are the theory of change, the logic model, and the measurement framework. These need to be detailed and correct. They should be revisited as the evaluation goes on. Taking the time to plan them and develop them, unfortunately, is often rushed or even done after implementation planning is done. And then, of course, when the evaluation results come out, the evaluation usually isn't very useful because it doesn't really speak to what the real questions were. So I had a couple others, but in interest of time, I'm going to skip down and I wanted to ask Will, in your experience, what role have you seen formative evaluation or summative evaluation play when it comes to decisions to sustain an intervention or to plan for sustainability?
Okay, thanks, Matt. I'm aware of an instance where there were real pressures to move forward with an intervention due to the desire from a partner who was providing significant funding, and the partner was very interested in moving forward with a favored intervention without considering negative formative evaluation findings. And in that instance, I'm aware of the capacity building providers and the agency leadership using those formative evaluation findings to clearly communicate their concerns and frankly, convince the partner to consider looking at another intervention that would address the same problem for the target population. I'm also aware of formative evaluations being used as really effective checkpoints for implementation teams to consciously consider, is there evidence that implementation of the intervention, should it continue because the indicators are moving in a positive direction, and it being clear that the intervention is doing no harm to the target population, as Simon had mentioned earlier. And then obviously, ultimately, thinking about implementation teams being able to use a summative evaluation to provide evidence to be able to answer that basic question of, do the outcomes merit ongoing investment in the intervention? So with that, I'm going to ask John, what in your experience have been some of the most tangible benefits for jurisdictions in taking the time to examine fidelity as part of the evaluation plan for an intervention, and what does a jurisdiction stand to potentially miss out on by not including a fidelity assessment in their evaluation plan?
Yeah, thanks, Will. And I'm glad that we have this last question in here, because I just think that fidelity assessment, in my experience, I'm sure a lot of you would share in this, is that it's such an essential, but it's often an overlooked part of an effective change and implementation process. I think, because fidelity assessments measure, both the extent to which an intervention's core components are being delivered, as well as the quality. The clearest benefit to the use of them, from my perspective, is that it can help teams ensure that their intervention is implemented as it was designed. And I want to emphasize that, as it was designed, because within our agencies in our field, we put a lot of resources and time when we make commitments to these types of interventions. One example of an experience I had that comes to mind was working with a jurisdiction that had chosen a new practice model as their intervention, and for which they had identified a number of core components as well as key caseworker activities. As part of developing a fidelity assessment for the intervention, they created a tool which utilized different data collection methods, and that included observations, documentation reviews, interviews, and supervision. I think the observations piece really stood out to me as just such an effective approach, because it had to involve some type of direct in-person contact and then information from the observation had to be recorded as to whether or not specific key behaviors relative to that practice model had been demonstrated worker during that particular intervention or interaction. And so, this included things like whether the caseworker had treated a parent with respect by greeting them by name and using a body language and verbal tone during the visit, or whether the worker had helped the parent or child identify individuals who were important and supportive to them to be included as part of the family team, or whether the worker had asked the parents, the child, or family members about any events that they had experienced that were potentially traumatic, and that was important because it was a trauma-informed practice model. So this type of valuable information is generally not going to be found in an agency's administrative data system, or even within a good but more traditional qualitative case review tool. So I think fidelity assessments like these are often overlooked or skipped over in part because there's a lack of familiarity in our field around the benefits of conducting them, and also because the development of a fidelity assessment process can be quite an investment for a jurisdiction to take on because it requires a certain amount of time and resources in order to get it right. The benefits, in my experience, however, far outweigh these types of challenges because fidelity data, it's unique, and it can be used to target areas in a different way that are needing improvement as well as areas of strength in order to improve implementation of the intervention over time. So with that, I'm going to turn that over to Simon. I know we've only got a little bit of time left for us to finish up today.
Yep. Thank you, Joan, and Will and Matt. And yes, we do have a few minutes. I want to make sure we get to a couple of these questions for the panelists to respond to. And so yeah, we'll move into the final section. I'm just going to make a shout out to this. Someone just asked a question around the Family First Prevention Services. So if you can move the slide forward, please. So we know with the Family First Prevention Services Act, it's moving us to being more prevention focused around early intervention. I think it's important with this, but it's also an opportunity where we need to think about building that evidence and what that includes. And I like the question about that it does require rigorous and well-designed evaluation. So what are some of those essential components? And we'll turn that back over to Matt, Will, and Joan in just a moment. But we included this here just to show that there is a connection to monitoring and evaluation efforts in child welfare. I think what's most important for us to make this shift, we do need significant expansion of research and evaluation that contributes to building prevention-focused systems. Of course, that helps to lead to improved outcomes. It's not to neglect child protective services where we know we have to do what we can to help children stay safe, but this prevention focus, we need more evaluation to know what works.
A diagram with a right-facing arrow displays several boxes across it containing text. From left to right, the boxes read, Vision of Prevention Focused System, followed by Building Individual Community Supports Based on Need, then Research and Evaluation of Interventions and Practices, then Better Understanding of Early Intervention and Prevention Focus, and lastly, Improved Outcomes for Children and Families.
So we know that policy procedures and programs, that will help build the field's understanding of what works. But as it relates to today's discussion, it also strongly requires evaluation of the implementation of evidence-based practices. That most, you're going to adapt them, but we really need to know what's working out there. And what's important to that, it doesn't always require just the evaluation of efforts, but we also, if we're going to contribute to the evidence and build it out, we also need to document and disseminate our findings and sharings of lessons learned to help build this wider child welfare knowledge base. So with that, we're going to move into a polling question, and this, go back to the polling question. So we need a short answer here about what are the anticipated challenges and barriers to implementing ongoing monitoring and evaluation of evidence-informed programs as child welfare shifts toward a prevention-focused system. This will move us back to the panelists to respond to that and also respond to some of your all's questions. So if you can just type a few short answers and we'll move back to the panelists. Capacity. The theme of the day, capacity. Readiness, enough resources, capacity staff to do it, yes. Funding, okay. Any more responses? clarity of the new rules around, I'm assuming talking about the Family First Act, the skills at the organizational level. I noticed there was a question earlier about the difference between program and what about agency level and the conducting evaluation being viewed as one more requirement for agencies already overburdened, building rigorous enough evidence that the intervention is working.
Other responses to the poll include maintaining longevity of consistent data, collaboration with all entities in the system, organizational readiness at all levels of management, and change in management behavior to spend the time needed in developing plans.
Okay. All right, so I see we have 5 minutes, so I'm going to use what we have here, and I'm going to, as you're still typing, I'll start with Matt, and of course Joan and Will jump in as well. And as you see these responses, I'm hoping they resonate with your experience. And so how does this relate to the ongoing need to build evidence of adaptations and consider evaluation early?
I think that what we've been talking about really applies even more to moving towards a system where we're trying to be evidence-based and evidence-informed over time rather than just having one-off studies. When I'm looking through the list here, I'm seeing lots of, capacity, skill level, collaboration, and I think what can really help is building long-term relationships with evaluators, whether they're in-house or external, to where you can start to not only continuous evaluation, but also I think it's important to have evaluators that are willing to help the agency learn how to evaluate themselves, so that over time it becomes less of a capacity issue. I think, too, there was someone who said what qualifies, I can't remember, maybe I was interpreting it, but what qualifies for evidence, I think it's really important to know. I think this is something that hopefully the feds will be clarifying as we go forward. So if you're going to do an evaluation plan for a prevention service, you'll know exactly, okay, this is an evaluation plan that would qualify. Will or Joan, have anything to add?
I mean, this is Joan. I mean, I feel like what you've touched on is spot on, Matt. What the challenge is, I think we're all looking at the list on the screen in front of us right now, is that there just a commitment as within our own agencies across the country that we have to somehow find a way with a lot of these limitations around readiness, capacity, resources, funding, skill levels, things like that. We have to be able to use the resources that are available, some of the things we've tried to put out there today. But what we're trying to do as a field, as a profession, is build that capacity so that when we go to clearinghouses and things like that, that we have, to Cosette's question, I think, that we have more, evidence-based, models that we can all kind of use and build on. So that to me is kind of what stood out from this conversation.
One thing I was also going to add, and this is kind of building off of Cosette's question, but even if a program is on an evidence-based list, evaluation is still important. It's just a different kind of evaluation. So you would want to document and approve adaptations, really make sure fidelity is achieved, and make sure that the outcomes you're getting are the same as would be expected given the trials of the program that were done. So evaluation is going to be important rolling forward.
Great, thank you. And I know that we have 1 minute left, and so I may go a minute or two over, and that's fine if folks need to jump off. But we are recording this event, and so we'll definitely have the link ready soon. And so if you miss an answer to a question, but I want to make sure we get to one question. I know we may have 30 seconds to answer, and that's probably not fair to Matt, Will, and Joan. But I think we covered some of this, but I think it's important to go back to this idea around the requirements that some of these things that are coming out, particularly with the Family First. So If it's required to have a very well-designed, rigorous evaluation, what do you consider the essential components for that?
Yeah, that is a tough question.
Yeah, I know.
In just a minute. I divide it into two. So if the service is already on an evidence-based list, then you're more saying, did we do a quality implementation and did we get the outcomes we would expect? If it's not on an evidence-based list, then you're more looking at a causal approach to evaluation. So you'd want like a randomized controlled trial or a quasi-experimental design where you're trying to say, this program, we don't know if it works, or maybe we have some promising evidence, so we're going to test it in a way that we can be confident that it is causing whatever outcomes we see. That becomes much more difficult. And in addition, not everybody agrees on what kinds of evidence can qualify. So I think having more information about what would be accepted is vital.
Great. I know that was a hard question, try to get anything out. I will tell the folks that are participating in this that we have made note of your questions, and we will reach out for further to give you more answers, and we'll share that at some point with others if they're interested. So with that, I think what we'll do is I want to just let you know on the top of the page above the slide is a couple of links. One, of course, is to our practice webpage where you'll find a lot of all the briefs and information, particularly in this topic. The brief for this topic will still be out in a couple of weeks, not quite up yet. And then we also have our evaluation survey to let us know what you thought about today's event. I want to use this opportunity to, if you've probably already gotten some messages about this, but just to remind and invite you all to attend our one-day Child Welfare Virtual Expo. You can register. The link is there. You can go to our Center for States webpage, and it'll also be on that. But this is hosted by the Children's Bureau and the Capacity Building Center for States. This year's theme is on effectiveness in child welfare, our role in improving the lives of children and families. And so this is a one-day digital conference. If you haven't attended before, it's a really awesome, innovative way to move from conference room to conference room at the comfort of your couch. If you want to do it that way, you'll hear from a lot of experts, peers, other states, local, tribal leaders, and it's just a wonderful opportunity to learn more and connect and do it in a virtual manner. I think it's pretty awesome.
Register for the Child Welfare Virtual Expo at https://capacity.childwelfare.gov/virtual-expo.
And finally, if we'll go to the last slide, please, is if you're not doing so already, we ask you to get and stay connected with the Center for States. There's a link here where you can register, and the Center produces a lot of great information and resources, publications, videos, trainings, lots of cool stuff that we want you to stay connected and access and use in doing your work. Also, you'll find us on social media, so go to Facebook, Twitter, LinkedIn, search for the Capacity Building Center for States, click follow and like, and you'll see all the cool stuff that we put out on social media.
Sign up online at public.gov.accounts/USACFCBCS/signup/10906.
And I appreciate you guys for staying on. I know it's a few minutes over. This was a lot of information and not enough time to really get it all in, but this is an important conversation. I thank you for taking the time to join us today and engage in this topic. I hope this event met your needs, and please reach out to us, contact us. You'll see some contact information there. You can also get to us through the website, and again, we will relook at your questions that were posed, and we'll develop some answers for that. And I'll just say have a great day. Thank you, everybody.
We are at the end of our scheduled time, so we will be finishing this webinar shortly. Feel free to contact us using our website, capacity.childwelfare.gov/states. That's capacity.childwelfare.gov/states. You can also contact us by our email address, capacityinfo@icf.com. That's CAPACITYINFO@icf.com. Or by our phone number, 844-222-0272. Thank you for joining us, and have a great day.